How do we define the success of a telehealth program? Telehealth programs have so many benefits and advantages that you will find many criteria for success.
Those hospitals that participate in our telehealth program, the patients that walk into those ERs leave a lot happier with the care that they receive than if it's the old-fashioned way without this technology.
We were able to show that from 2004 to 2007, we had a statistically significant reduction in mortality.
I think the biggest success that we have is that we have the availability of specialty care when we need it.
Success for a telemedicine program is increased usage, patient satisfaction, and provider satisfaction.
Our program defines success by being sustainable. If you don't have a sustainable program, it will be dead in the water in a few years.
What are the characteristics found in successful telehealth programs that favor success? Why do some programs sail forward, meeting community needs and expanding services, while other programs end up with the telemedicine unit in the corner, unused? First, there is no substitute for program planning. Those programs that conduct a needs and market analysis and create a business plan will achieve higher levels of success.
You first have to see, is there a really genuine need for the service? And you may think there is, but unless you do a detailed analysis and see if there's providers there, then you're wasting your time.
We actually took a case management approach. We looked at our population and we decided that diabetes was big. It's for Native Americans. We're double the rates of mainstream population. So we decided to focus on that.
What is it we want to achieve? What are our goals or objectives? What baseline data do we want to measure before we start? And then what baseline quality data do we want to measure after that we want to say that the tele-ICU program affected this care in this way?
Successful telemedicine programs have well-defined program objectives, alignment between program objectives and the mission of the organization, identified demand for service with a sustainable service model. Management that is dedicated to the successful implementation and operation of the program with clear accountability is critical to the success of any telemedicine program.
We had very early involvement from the CEO of the healthcare system who was instrumental in really framing the vision for this, and he gave us our charge.
And if you don't have your medical director and your provider staff on board with this telemedicine, it's not going to go anywhere.
Our president and CEO of the company at the time had seen an EICU in Norfolk, Virginia, and saw a physician actually taking care of a patient in an urgent crisis, and he felt this was something that he wanted his health system to utilize.
I think strategic best practices, again, get back to an organization really working with its board or working with its governing body to really decide that telemedicine is part of its future and part of its vision and how that's going to fit.
To ensure these components are in place, both an organizational readiness and needs assessment should be completed. A companion publication, Assessing Organizational Readiness, and other program development guides are available at the CTEC website. A successful telemedicine program also requires the development of a business plan. A cost-benefit analysis will demonstrate how telehealth will impact your business and financial outcomes.
You have to look at your reimbursement rates in your particular agency and if it's going to cover the costs or not. Is this going to really be able to sustain itself? You know, if we lose a little bit, is that okay? If we lose a lot, is it worthwhile?
When we finally were able to figure out what it would all cost, which of course takes time to figure out, we figured out that it was going to lose money for 9 months and then potentially start to break even, and everybody involved said, whoa, we don't really have 9 months of funding for this project right now.
Sustainability is a core challenge facing telemedicine programs. Funding from a variety of sources, including reimbursement and grants, is critical to sustainability. The most successful telemedicine programs identify in advance the program's expected capital and operational funding.
Look for grants. And there's a lot of grants out there now for telemedicine and through the state and through the feds. That's well worth applying for small rural clinics particularly.
I think you need to do a good feasibility study to figure out what it's actually going to cost you. Try to be realistic about how long it's going to take to get things started.
Once your organization has identified telemedicine as a priority, you are ready to begin laying the groundwork for implementation. The most successful programs incorporate telemedicine as part of the routine clinical activities of the consulting professional. A credible and qualified clinical champion is key to successful programs.
We have at least one physician champion. We're lucky enough to have two that are very supportive of the program, and they're the ones that are our marketers, basically. They go out and they're the ones talking to our physicians, getting their buy-in, getting their input, getting their suggestions on where you need to start is always very important.
It's important that there's actually some people who are excited about it, who want to make it work. I think without that, it's probably going to fall flat.
Buy-in is key. You've got to get everybody on board and with a strategic plan. And the number one thing you need is a local telemedicine champion. Somebody in that clinic that's going to make sure that visits happen, that providers are aware of the telemedicine services that are available, and you'd be surprised, how it can just kind of go by the wayside really quick if there's not somebody there kind of championing it, being the cheerleader.
One of the biggest factors that I think is will project success is having a champion on both sides, the hub and the remote side. And not only a clinician champion, a doctor or a nurse that's going to be doing the consultations, but also an administrative champion that is going to support the program.
The champion is sharing information with other members, whether it's administration, staff members, receptionists, patients. They help the program grow and succeed sooner.
The development of a telemedicine program not only involves organizational commitment, but requires implementation, planning, and ongoing operational support. Successful programs have enough staff to provide leadership and operational support, including equipment maintenance. Telemedicine programs benefit from program directors dedicated to managing the resources required for its operation, including training, scheduling, billing, and technical support.
If they can have the position of a telemedicine coordinator, it significantly increases your use and success of a program.
Somebody has to own the project from the very beginning internally. A project director, a coordinator, somebody owns the patient engagement function in a way that brings patients into the process and is engaging and outgoing from a marketing standpoint and encouraging doctors and nurses to use the system.
Successful telemedicine programs understand their market and their potential customer base. They consistently promote, educate, and inform their audiences about the many advantages and benefits of telehealth.
And I've seen some tremendous examples in communities where an organization has done a fabulous job at being able to share those successes and share the access to care that they've provided, what they've brought to the community because they have taken the time to implement a telemedicine program. Promoting that offers an opportunity to share with your community and perhaps develop philanthropic support and develop goodwill within that community and give back to the community.
Finally, successful telehealth programs have strong evaluation components. Evaluation assists in determining if the telemedicine program is meeting its objectives and suggests possible improvements. Measuring your success with data will help advocate for your program and will assist in obtaining funding and support.
But we're working with some very sick people. We're getting some good care out to some very sick people, people with bipolar, schizophrenia. But once you see some of the results, it's like, oh, you've turned somebody's life around a little bit. At least they can control themselves and be in society. It's really kind of neat.
When I see a young kid up in a Northern California county who would no way have telepsychiatry service from a child psychiatrist, getting the proper medication, getting back in school, stop destroying stuff at home, that's really exciting. That's what it's all about.